Hi, Dr. Avinash. Thank you for joining us once more today. And for the viewers, today we will be discussing questions related to only postpartum anxiety. There has always been a lot of talk about postpartum depression, but today we will be covering postpartum anxiety. So the first thing I want to ask you, Dr. Avinash, is what is postpartum anxiety? Is it just regular anxiety? And it's the timing because it happens postpartum that makes it different, or is there anything different about the nature of the anxiety itself?
So, we all know anxiety is a condition where there is apprehension, worry, dread, etc. And postpartum anxiety is anxiety that happens immediately after the delivery of the baby. So, it generally happens during the adjustment period after the birth of the child, where you're adapting to the birth, the circumstances, the bodily changes, multiple things. Anxiety can happen at any point of time, but the specifics of postpartum anxiety is that it has to happen after delivery and it has to happen within the first 4 weeks after delivery. So, when that happens, is when we refer to it as postpartum anxiety. Otherwise, anxiety occurring throughout can be referred to as generalized anxiety or social anxiety, depending on what situation the anxiety occurs in.
Okay, so it has to be during the first 4 weeks of anxiety.
It has to
First
start in the
four
first
weeks
four
of
weeks. It may continue for a long
after
time, but it has
delivery.
to start.
It has
Yeah.
to start during the first 4 weeks of delivery. So, practically speaking, in your experience, how many women during the first 4 weeks, that is within the first month of their delivery, are able to recognize that what they're experiencing is anxiety and then even communicate it to their family or go and seek help for it?
So, most women experience both depression and anxiety in the postpartum period, but many of them are told that it is normal. There are hormonal changes, there are factors, you're adapting, you've just become a mother, there is stress,
Correct.
there is mother in law pressure, there is family pressure. So, many of them think that it is absolutely normal to have this anxiety.
Okay.
The worry, the crux of the matter is yes, it is very normal to be anxious as a new mother,
Yes.
but if the anxiety is overriding your life, that you're not able to take care of the baby, you're not able to breastfeed, you're not able to sleep, you're not able to eat, you're panicky, your hands are trembling, you're not able to speak, that means the anxiety is of such intensity or severity that it is crippling you in your day-to-day activities. Then you
Okay.
obviously need to seek help. But
Okay.
if you have little anxieties, I mean, whether my baby has slept, has he got up, has he
That is
fed, I
normal.
mean, those are normal anxieties that happen with any mother, and I think that's
Correct.
fine. But
Okay.
when you get a panic like feeling and you feel I'm going to die now, something is going to happen to me, and you're not able to as a result look after your baby, then
Mm-hmm.
you definitely need to seek help from a mental health professional.
Okay. And how common is postpartum anxiety?
Well, I think at least 30 to 50% of women
Mm.
undergo some amount of postpartum anxiety. But if you ask me, around 10 to 20% undergo it to the extent that you need help. But
Okay.
and I think everybody undergoes mild anxiety, so that is very common. But 30 to 50% have anxiety, which can be managed with family support, etc., little counseling. But around 10 to 20% need serious mental health help.
Okay. And are there any causes to this? What causes postpartum anxiety? Are we able to know what causes it?
So every phenomenon in mental health, I always say, is a biopsychosocial phenomenon. There are biological factors. So here there are hormonal changes that are happening. There are physical changes in the body. There are chemicals in the brain which go up and down. Sleep cycles get disturbed. So biologically there are changes that are happening. Psychologically, the pressure of being a mother, the pressure living up to the expectations, the pressure that you can't go anywhere for the first few weeks because the child is small, your
Correct.
own sleep cycle gets disrupted. There is so many relatives are coming, each one is giving their own input. There's
Mm.
so much of expectations from everybody.
Mm.
And socially also, I mean, there may be some pressure in a joint family, there may be comparisons, there may
Mm.
be pressure from a mother-in-law, pressure from the co-daughter-in-laws. So we see a lot of jethani bhaiya problems that happen, in families. We also see sometimes the husband may be away the whole day, so the wife feels alone at
Mm.
home, and the husband
Mm.
doesn't spend enough time because he has to work. He's in a office job or he's in a
Mm.
traveling job. So these kind of things
Mm.
also are some things which are worrisome. And uh, also sometimes in families, if the mother is new and she's learning, then every mistake is looked at very critically. That
Hmm.
also causes a lot of anxiety to the mother. So there are multiple factors that play a role. And we always have to remember that anybody who's had an anxiety disorder before, that
Hmm.
is, if you had some panic or some social phobia or some PTSD in your life ever, the
Okay.
chances that you may develop postpartum anxiety are more. That is one. And
Okay.
also, if you are generally anxious as a personality, so there are some people who are anxious, small
Right.
things they will get worried about.
Hmm.
They worry about each and everything in life. So
Hmm.
they are very compulsive. They want everything to be perfect.
Hmm.
And if things don't go perfect, then they are upset. So these kind of people are more prone to postpartum anxiety.
Hmm. 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 So, so since you mentioned that the anxiety has to start within the first 4 weeks after delivery, I am still with the interactions that I have had with women, and personally also, really in the first 4 weeks, that is the first month, is we're so overwhelmed with everything that is going on. Is there any, I mean, do women really come to you during that time seeking help during the first month? Because I think the focus just completely shifts after delivery from the mother to the child. And the focus of the mother itself shifts from herself to now the baby. So, do they come during the first month saying that, this is what I'm experiencing, unless it's an extreme case, or in most cases, do they come later and say that, no, I think this began during the first, immediately after delivery? So, I'm just curious that do they really come that early seeking help?
So what happens normally is that in the immediate postpartum period, that is the first 1 or 2 months,
Hmm.
uh, they are generally referred by the gynac. The gynac is the one who
Okay.
sees them the most. So the
Okay.
gynac
The
says, "I think
gynaec
you
is
have
then
a problem,
informed.
and you need a." The sadly, not all gynacs are well informed. So not all gynacs are able to detect, but
Okay.
those who are, they refer. Sometimes they prefer to see a counselor first because I think the stigma of seeing a psychiatrist is still very rampant. And
Absolutely.
most importantly, the worry is that I will, as a doctor, prescribe medication and the child
Medications.
has to be breastfed. So,
Hmm.
will the medicines go into the breast milk and affect the child? But
Hmm.
what a lot of people don't know is that most psychiatric medication are secreted in very, very, very small quantities in breast milk. So, the chances of the baby getting drowsy or the baby falling asleep or any side effects in the baby is very, very rare.
Hmm.
We very safely prescribe a lot of medication during breastfeeding. So there
Okay.
is no worry on that count. But
Okay.
there are times when the anxiety is so debilitating that the mother-in-law, the husband, the wife, they realize that there is no option but to give
Hmm.
medication. So what we normally suggest is that we will keep the patient on a night dose, and
Okay.
maybe what the patient can do is give the last feed by around 11:30 in the night, and then take the night medication.
Okay.
And they can always either maintain a feed at 3 a.m. or 3:30 when the child needs an extra feed,
Hmm.
or they extract some breast milk and keep it, and that can be given at 3:30.
And
And then
then
the
they
first
take the
feed at 7
medication.
in the morning, 6:30 in the morning can again be given, because sometimes even a continuous night sleep helps in reducing
Helps
anxiety.
in, yeah,
So
regularizing
yes,
things.
so
Yeah.
we normally advise that.
So, there is a lot of role of hormones in creating this sort of a situation, because like we've seen that even when a person has anxiety, the anxiety usually gets worse just premenstrually, or when they are in the perimenopause phase. So clearly hormones have a role to play. So now where IVF is getting more and more common, where multiple pregnancies are common, delayed pregnancies or complications during pregnancies where the mother is having to be on hormones, does that have a role to play somewhere where they are? I don't know. This is something I again, I'm curious about this, where they are, when they are being given progesterone, and then progesterone has an effect where, it affects your mood. And then when it's suddenly stopped, or when after delivery, when, it's cut off. Does that, could that trigger anxiety?
So any change in hormonal factors can affect mood. Any change in hormonal factors can affect anxiety. Even if there are hormonal pills that a patient is on, that can affect. And any complicated delivery, always the mother is more cautious post delivery, that the
Hmm.
child has to be looked after more because the baby is precious and there have been complications from which the baby has
Hmm.
been born.
So
So I
anyway,
think
the
that
anxiety
itself is
level
a
is
cause of
high.
anxiety. that itself is a cause of anxiety.
Okay. All right. So otherwise, you're saying that it's not that because they are on progesterone supplements or because they
No, no. I
that
don't think progesterone on its own per se is a cause. There are factors in and around all that
not a
happens.
cause, but it could aggravate things. It could predispose you to anxiety. Would you say that?
No, not really. See, there are a lot of people who are on oral contraceptive pills throughout
Okay.
their cycle, and
Hmm.
that also
Correct.
has progesterone. So it doesn't mean that they get anxious.
Okay.
It all
When
depends
it's
on
cut
what the
off
home
doesn't mean that
situation
you're
is. Yeah, there are a lot of constellation of factors that play a role.
okay. Okay. And is there something that can be done pre-pregnancy or when you're planning your pregnancy so that you don't get prone to postpartum anxiety? Is there something that can be done before you?
So I think that the girl having her mother around is first the best help. If she is
Okay.
happy with her mother, if she
Okay.
doesn't get along with her mother, then it's better to avoid the mother being
Avoid the
around. Both,
mother.
both, both have to be looked at.
Hmm.
So if you have to ask her, who are you more happy with, the mother or mother-in-law, and depending on what answer they give you, let her
Okay.
go to her own house for some days. That's the best place. She can be herself, even if she throws a tantrum or two, because of the vulnerable state that she is in. It is, looked at and managed better,
Hmm.
and she's always more comfortable in her maternal home, in her paternal home. So it's
Okay.
absolutely fine. But of course, I mean, that's not the only protective factor. Family
Hmm.
support, financial issues, the kind of relationship she has with her husband, the kind of whether she's a working woman or non-working woman, multiple factors play a role.
Hmm.
See, working women are more anxious because the worry is that they have to also get back to work within certain days post delivery. So the worry is, who's going to look after the child? How is it going to be? How is it going to be without me? So
Hmm.
leaving their baby for so many hours and going away to work is also something
Hmm.
which worries them.
Hmm. Hmm. Okay. And are there any misconceptions that you see commonly about postpartum anxiety?
So a lot of sometimes people feel that, oh, she is a little lazy. She doesn't want to take care of the baby, so
Okay.
she's doing all this.
Okay.
So some people say, oh, she probably it was an unplanned pregnancy. She did not want the baby. So this is her
Okay.
own
So there's a lot
way
of
of
blame.
that way that blame that does happen.
Hmm.
Then sometimes, sadly, in our society, people even think probably she had anxiety even before marriage. We were not told, and now
Oh,
it has come back.
okay.
So they try and inquire whether this was an old illness which has come back, or is it a new illness. So these are
Okay.
things which also worry, and they think. And the moment they have to take their daughter-in-law to a psychiatrist, they think, oh, is she mentally ill? Is she going to be mentally ill for the rest of her life? Is she going to be on medications lifelong?
Hmm.
Are the medications addictive? And I mean, very often I tell parents, I mean, who come to me, or I tell the husband or the mother-in-law that comes to me, what if she had a kidney problem? What would you have done? I
Hmm.
mean, you'd have quietly taken her to a nephrologist and given her
Hmm.
all the medicine that she needed. What
Hmm.
if she had a heart problem after delivery? You'd have quietly taken her to a cardiologist and
Hmm.
done whatever was needed. So when there
Hmm.
is a mental health issue, you come to me. So
Correct.
whatever needs to be done needs to be done. The why is there so much of a hullabaloo around psychiatric medication?
Hmm.
It all medications have side effects. So
Hmm.
why is there? But the stigma is more with psychiatry.
Okay. And once a person is diagnosed with postpartum anxiety, typically how long does it take for them to recover from this?
No, so generally recovery is not that long. In around 2 or 3 weeks, the anxiety can subside totally, but
Okay.
they may have to be on medication for even 6 months.
Okay.
They can't just stop medication soon. But
Okay.
recovery can definitely happen in around
Sooner.
2 to 3 weeks.
Okay. And let's say somebody does not recognize that this is anxiety and this is severe enough for me to require medication, and they just go on with their life thinking that this is parenting is hard and I just have to go with the flow, and this continues, then what happens? Does this then develop into generalized anxiety disorder or panic disorder, or
Yes,
what
so
happens in cases untreated where it goes
anxiety,
undiagnosed?
untreated, undiagnosed anxiety can continue. And then we might have a full blown anxiety disorder that develops, and you may treat it like any other anxiety disorder. So, and
Okay.
then you may need to be on medication for a longer time. You may need counseling for a longer time. So overall,
Okay.
the duration of treatment gets increased.
Okay. Okay. And are there any supplements that help during this phase?
Well, I think omega 3, B12, seeing that your vitamin D levels are fine, uh, B complex vitamins, all these play a role.
Okay. Okay. Anything else that you would like to add?
Well, I think people have to understand that the lady who has finished a pregnancy and is just delivered a baby has gone through a lot to get there. Okay, it's not easy. The 9 months have been life changing. They've been physically changes, they've been mentally changes. The whole process of either a cesarean or a normal delivery is also quite uh, a tiresome one. And it's not easy to, breastfeed every 3 hours, then sleep when the baby sleeps, eat when you can, cater to the needs of everyone who's coming to meet you. And, at the same time, try to look after yourself, and then we criticize at times for something that goes wrong.
Mm.
So I think we have to give a lot of social support to our mothers.
Yeah.
It's very, very important. And I think workspaces also have to understand that, mothers should have flexible work facilities. They could work from home, they could work. And it's not that becoming a mother makes them lose their shine or their ability to work. It's not that. They can always get back to work. And I think fathers have to take equal responsibility in bringing up the baby, I think, which is very, very, very important. I mean, I always remember when, my son was small and I used to be out the whole day working. So I would, come for lunch, be there for some time, and then again go to the clinic, come back. And I
Mm.
know in the night when I used to come, I used to tell my wife that, you see TV now, do what you want. Leave the baby with me. And in the
Okay.
night, I would tell her, once you've done the feeding at 12, you just go to sleep, get up straight at 9 o'clock, in the morning. The
That's really
the two
nice of
feeds,
you.
the two feeds, there was a 3 o'clock, 3:30 feed. So we would keep an alarm. I would keep an alarm, get up,
Mm-hmm.
and I
Mm-hmm.
would sleep in a separate room. So the alarm would not, disturb her
So she would
sleep.
not
So
get
I said
disturbed.
that, but invariably being the mother, she would get up at 3:30, ki,
Right.
are you able to feed? Is everything okay? And, I would tell her, there's
Mm.
no need for you to get up, go and
Mm,
sleep. And
mm, mm,
but then
mm,
still she would, out of her own anxiety, get up. And then
mm,
she would again get up at 7 o'clock. So I would tell her, you rest. But then she would at least not have to go through that half an hour of being awake to
mm,
feed, at least, which would
mm,
make her
mm,
lose her sleep. Or I would tell her,
mm,
you go back to sleep, and, and then the baby would naturally sleep off after being fed. So there was never a problem. And then
mm.
slowly we weaned off the night feed also as fast as possible. So
Okay.
the baby began to be delayed the night feed to around 12:31, and
Okay.
then the baby got up straight at 7:30 for the
Okay.
next feed.
So then you get a
So
full night's sleep
so
at
yes, so
least.
in around 2-3 months we could wean off the night feed, which was very good.
Okay.
So I
Yeah,
think
I'm
so
sure.
that also is something that parents have to realize. That's a
Hmm.
technique that comes, and I think it's something which is, I think, very, very essential. And I think if but then again, I also say this, that I had a job where I could plan my timings. So
Correct.
it was possible.
Everybody does not
There's not
have that
everyone may
liberty.
not be able to do this. So I'm not saying
Yes.
that, there may be men who have to get up at 5 o'clock, catch a 7 a.m.
Yes.
train to reach office at 9 a.m. So,
Yes.
I can't expect them to do this. This is my story. It may not work for everyone. Yeah.
Correct. Yes, yes. And my last question, Dr. Avinash, is that since gynacs are the ones who meet these patients, what is it that you would like to tell, a message that you would like to give these gynacs, to all gynacs? Because I think if they are sensitizing the patient about it, just the way they talk about everything else, about nutrition and, exercise and everything else, taking care of themselves, uh, do you think that there's something they can tell them or ask them,
Yes.
about themselves? I don't know how many gynacs really ask the mother once she goes for her follow-up that how are you feeling? Uh, how are
Yeah.
you
So I
doing
think I
mentally?
think gynacs talking to the mother about mental health. Do you feel sad? Do you feel low? Do you feel anxious? Is your
Mm-hmm.
sleep proper? And referring them at least to a counselor to start with is something which could be the first step.
Mm-hmm.
Gynac should never, never, ever tell patients that, don't take psychiatric medication. They're bad for your health. Don't do this. It's okay. I understand you may not know about psychiatry, but when we don't tell them, don't take OC pills. It's bad or whatever. So, why spread the wrong word? I mean, and I think if you have any issues, there are times when, we have prescribed medication. And I had a patient who said that the gynac has been apprehensive that I'm
Okay.
taking these medications. So I've said,
Okay.
put me on the phone to the doctor, let me talk to the doctor. And doctor to doctor, we talk, we rationalize, we analyze. Even if I have to change medicine, I have done that. It's not that. And I mean, we've reached somewhere whereby, we both are on the same page. So I
Correct.
think the gynac and the psychiatrist can liaison and,
Okay.
make life a lot easier for the patient.
Okay.
There are times when the patient needs help and the family is not ready to take psychiatric medication. I know there are some gynacs I work with who ask me that they will not see you, but this lady needs help. What is it that I can prescribe? And I tell them, please prescribe this, and they at least start medication. But because it's
Okay.
written by the gynac on her
Wonderful.
letterhead, they are,
Okay.
more open to taking it.
Okay. 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 Brilliant.
Yeah. So,
Okay.
yes. So that I think is a liaison that can be done very easily.
Okay. Okay. Thank you, Dr. Avinash. Those are all the questions that I had for you. Thank you so much for making the time today.
Thank
And
you.
I will
Thank you so
connect
much.
with you soon again.
Sure. Sure. Definitely. Thank you so much.